I,
I thought I had one on here.
hi, everyone. We're gonna get started as soon as Kevin gets here. He's just a few minutes late. All right, just can everyone hear me? We're waiting for the state's attorney to get started, so we'll just be a few minutes delayed. Jackie, since you were the first one up, will you lead us in the pledge?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
A roll call, please. Oh, yep, hold on. Why am I so microphone challenged?
Berkowitz,
Here.
Butler,
Here.
Ortiz, Oxley, Trenier,
Present.
Winfrey, Newquist.
Here.
We have a quorum.
Thank you. I don't believe we have any minutes to approve. So next up is public comment, and I understand we have some folks wanting to, make some comments. So I invite you all up to the microphone. So he can make his. Let me turn your mic on. Oh. Yep. Can you press your mic so I can turn your mic on? Okay, there we go. There. Okay. Thank you.
Hi, I'm Elizabeth Bellata, the Executive Director of the Health Department. You know me. So I just have a statement, please. I am here respectfully presenting again a request for additional funding for the Health Department to retain several core public health positions. Public health is to prevent the occurrence and spread of disease and illness through programs, health education, and surveillance of health trends. According to Title 77 of the Illinois Administrative Code, it is in the best interest of Illinois citizens to have public health services delivered at the local level by local health department. NACCHO's CEO stated that the pandemic showed us what a stronger public health system could look like. Public health threats aren't going away. They are returning to an even more weakened system, demanding more, not less, of our local public health workforce. According to the Illinois Public Health Workforce Transformation Initiative that was conducted by University of Minnesota, based per capita, Illinois ranks 40th among states and the District of Columbia in regard to our investment in public health. People are lined up out the door at the community health center to get those precious same-day appointments. Our behavioral health and community health center appointments are booked out 2 to 4 weeks. As more and more cuts and changes occur at the state and federal level, more people will need our services. We provide a critical service to the community and our staff that are doing the job because they have passion for public health. We truly believe we're making Will County healthier, stronger, and safer. In 1942, the health unit was created with environmental health, communicable disease, and maternal health services. And in the 50s, behavioral health was added. In 1996, based on the needs of the community, a primary healthcare facility was established, which then became our federally health qualified community health center in 2001. We fill the gaps. We provide the services for the young person who is struggling to find the job that doesn't have insurance, for the seniors who are looking for low-cost pharmaceuticals, and for the kids needing behavioral health services right where they are at the school. I have provided you with a letter of support from our Board of Health, our 2024 annual report that shows our number of services, and our impact statement. Our patients and clients are not a number on a piece of paper. They are the elderly man who walks to the health department several times a week, the pregnant mom that's coming for her prenatal visit and education and nutrition, and for our food service operators looking for guidance to ensure their products are safe. It's hard to put into words and to put on a piece of paper for someone to understand what we do unless you live and breathe public health. I'm proud of what we accomplish every day. Our agency's policy is when a grant ends, the staff that are funded by the grant are eliminated. And we recently eliminated 2 positions, one in EPNR and one in Family Health Services. However, this time I am asking for support to retain some core public health positions, which will be lost due to funding cuts and reductions, so that we can continue to serve the community at the level we're providing them now. Thank you again for your time. The Health Department is extremely appreciative of all the support provided by our Board of Health, the 708 Board, the County Board, and the County Executive. We don't want to return to an even more weakened public health system, just as chronic health changes, opioid overdoses, maternal health issues, and future outbreaks demand more, not less, of our public health workforce. Thank you again for your time.
Thank you. Did you have any? And you guys, I apologize, I forgot to add that for public comment, you have 3 minutes. You were within the 3 minutes.
Denise is gonna come up and.
Okay.
obviously,
Okay,
thank you.
please come up. Let me-
Sylvia.
Can you please press your microphones so that
There
I
you go.
can turn that on? Okay,
Good morning. My name is Sylvia Muñiz, and I've been a Will County resident in Bolingbrook since 2004, where I have raised my 3 children, ages 23, 19, and 6. I am also a maternal child health nurse with 19 years of experience in the hospital setting in the last 10-plus years in public health. You've heard me speak in the capacity of the Director of Family Health Services Division at the Health Department, and I thank you for hearing me out again as I stress the importance of the work done, specifically by our staff in Family Health Services. The ARPA funding that was greatly needed during and since the COVID pandemic has allowed us to satisfy some of the needs of the residents of Will County. Other recipients of this funding utilized it to purchase items or build structures, but we did not need those types of resources. That would have been frivolous on our part as we moved into a much-needed new building in 2020. We needed qualified people to deliver services to meet the needs of the public, including immunizations clinic, communicable disease, and sexually transmitted infection investigators, and maternal child nurse case managers. Currently, we have 8 people in our immunizations program, which has allowed us to deliver program services on site at schools, in the homes of those that are unable to leave their homes, increase our appointment availability at the branch offices. Upon expiration of the ARPA funding, we will lose 2 registered nurses, a manager, and a clerk, half of our immunization staff. This will create a reduction in services and impact the community in such a manner that the removal of on-site school clinics will result in the exclusion of more children who are non-compliant with vaccine requirements. Fewer to no appointments will be available at satellite offices, and the homebound program will cease, creating a gap in immunization services for those families. In 2024, our immunization staff conducted 100 homebound visits, administering 249 shots, and we served 255 clients at off-site clinics, including assisted living facilities and community fairs. We served over 3,800 clients at all 3 of our locations, over 1,000 more than so in 2022. Elimination of ARPA funding will also impact our HIV prevention and STI surveillance programs through reduction in staff of 2 RNs and a manager, resulting in less access to HIV testing and PrEP services, leading to an increased spread of HIV. PrEP prophylaxis, pre-exposure prophylaxis can protect those at risk for contracting the virus, while timely, proper HIV care can allow patients to achieve undetectable status, making the virus non-transferable. This is huge. In 2024, in collaboration with the Will County Health Community Health Center, we had 231 PrEP clinic visits, 414 HIV tests, and we identified 12 new HIV positives patients, linking them to care and case management. In addition to HIV prevention, our STI, sexually transmitted infections surveillance nursing staff, will be reduced, leading to a delay in investigation and case management, resulting in increased spread of STIs like syphilis, hepatitis B or C, or Mpox. The most recent maternal mortality and morbidity report published by IDPH in October of 2023 stated that maternal mortality and morbidity continue to be a public health crisis in Illinois, with continued unequal experience of poor maternal health outcomes for different racial, socioeconomic, and geographic groups in the state. Nursing case management programs are aimed at combating poor maternal outcomes with education, support, and guidance for those families at risk. Our team of registered nurses and an administrative assistant in our case management program provides services to an average caseload of 1,100 people per month in 2024. Services include home visits, prenatal education, newborn and infant education, collaboration with providers, advocacy, and referrals to other resources in the community. A reduction of services to medically and socially at-risk women and infants would lead to an increase in maternal and infant morbidity and mortality. Additionally, it would result in a preventable increase in overall dollars spent on the child and a burden on the family and society. And I put burden in quotes. Am I done?
I do need you to wrap this up.
All
Thank
right.
you.
Please keep in mind that we are in the business of helping people. We're not politicians. We do not discriminate. We simply serve. We do so in a fiscally responsible manner, fully aware of the monetary limitations of our work, but we cannot let go of the importance of our services.
Thank you. Who's going to speak next? And if you could keep your remarks to 3 minutes, thank you. Okay, go ahead.
Good morning, Denise Bergen, Assistant Executive Director at the Health Department. Each year, as we work to meet the needs of our community, our level funding does not go as far. The Health Department levy allocation is flat. Our last increase was in 2023. Before that, 2018. Over the past 10 years, our levy allocation has increased 14.1%, around $1.36 million. Our expenses have increased 48.5%. We have covered annual staff increases, rising benefit costs, increasing service fees and supply costs through grant revenue, fee-for-service revenue, program and service elimination. It's also important to remember that many times funding sources are for specific expenses or targeted activities. We routinely review fees to ensure that we maximize revenue while remaining competitive and affordable to the clients we serve. As an agency, we conduct program reviews to better meet the changing needs of our community. Over the past few years, we've eliminated several underutilized programs, including vision and hearing, lead prevention, and crisis care systems. We have and continue to closely monitor federal and state policy and funding changes, which will impact the health department and our community. And we have felt these changes. Reduced grant funding has led to the elimination of staff positions. State fiscal year 26 grant awards have decreased by over 300,000. For the upcoming county fiscal year, grant funding is reduced by another 600,000. And we're bracing for other changes. Changes to Medicaid enrollment and coverage and marketplace increases will leave many residents uninsured. This will negatively impact the health of some of our most at-risk residents. This will lead to an increase in the number of uninsured individuals we serve and a corresponding decrease in the Medicaid and marketplace payer revenue that we generate. Based on these challenges, we submitted a request for additional support of $1 million to ensure that our public health safety net endures. We are seeking to retain 11 critical positions across 4 core public health programs. As a certified local health department and a safety net agency, we work to ensure that the needs of our community are met. The challenges we are facing and the potential reduction in public health infrastructure is a threat to the health of Will County. It is our responsibility to attempt to mitigate that threat. Thank you.
Perfect. Just 3 minutes. Thank you for your concerns. All right, number 8 and then number 9. Hold on one moment. Okay. Oh, didn't turn you on. Hold on.
Red is go.
8.
Hi, I'm Pam Robbins. and
Wait, hold on a sec. That's weird. I hit that several times. Hold on. Sorry about this. We're good. Okay. Go ahead.
Hello, I'm Pam Robbins, registered nurse for over 45 years. Also serve on the board of the Will County Public Health Department. One of the things that is important in the mission of the Public Health Department is to prevent disease, to address pandemics, address health disparities. Public health plays an indispensable role in protecting our community. I've been able to see over the last 2.5 years, the incredible work as a fellow nurse, what the nurses and the other experts that provide services at the Will County Public Health Department. But I think putting a face to what they do is probably more important. So I'm going to share with you a real testimony and story of what happened at the Will County Public Health Department, assisting a person in our county. In July 2024, a nurse that had worked at St. Joe's Medical Center for about 5 years had delivered a non-viable child early in July and became pregnant that following year. In March 2025, the hospital was bought by another provider, and she delivered another baby girl. The nurse was told that she had had enough hours covered by FMLA in early August and called the pediatrician to make an appointment for the baby's immunizations. The nurse had called Blue Cross and Blue Shield because she was told that she didn't have any insurance anymore. She was neither notified by them, never offered COBRA, and that her and her baby did not have services of insurance. She was dropped as of August 1st. She attempted multiple times to work with HR department in that hospital, and the hospital was able to unfulfill her ability to get short-term disability for her and her child. Not knowing what else to do, she went to the Will County Public Health Department. Through the expert services of that, she was informed, as she kept telling them, I'm a nurse. I have a job. I got terminated and I have no benefits. She would be returning back to work in the first or the second week of September. The health department at that time decided to place her on Medicaid for 3 months and the baby for 6 months, and also was given SNAP benefits. These are the people that this wonderful department take care of. They're not all homeless. They're not all disabled. They're not all having something that someone thinks that they should be able to pull up their bootstraps to be able to do. These are people that are found in healthcare care gaps. This is what the Will County Public Health Care does. For every person that walks through that door, the doors are never shut. What the minimal amount of money to keep this floating is so important, because when they're healthy, providing healthcare for people that stay healthy, those people go to school, those people go to work, and those people have incredible, they're not making a lot of money, but they're helping the public. So thank you, and please consider funding what we need to do in Will County.
Thank you very much. Whichever.
Are you talking about health? Health? Are you doing the health department? Yes. Yeah, keep going. Oh, okay.
Oh, I think you were on. Let's see. Let me turn you on again. Oh, you need to press your, thank you.
My name is Dr. Silvio Morales.
Bear with me one moment. Oh, he was on and I turned it off. Hold on.
Press your button again.
Yeah.
Thank you.
Thank you. 11, mic on. Okay. Go ahead. Sorry about that.
No problem. My name is Dr. Silvio Morales. I'm a full-time practicing emergency physician in Will County and a member of the board of the health department serving my second term. I would not be able to detail all the evidence supporting the health department's request for additional funding. But I can say that as a member of the board serving my second term, I have had a close-up view to the difference that the health department makes to the public health of the residents of this county. And as a practicing emergency physician in Will County for 20 years, I see the need for those services every day. I see the need of individuals who don't have access to care, who don't have a safety net, who don't have access to behavioral health services. I see the impact that that has on the community. These services are vital, and I urge you to favorably consider the request.
Thank you very much. Sir?
You can keep
Oh,
going. We're
okay.
on a good theme, so.
All right. Bear with me 1 minute. Okay.
Good morning. My name is Edna Brass, and I'm also a member of the Will County Board of Health, and I've served on the Will County Board since 2022. I'm here to advocate for those additional funds also. We want to be able to sustain critical staff and programs that will be affected by funding cuts. We want the Will County Health Department to continue to play the crucial role it does for public health in our communities. Public health plays that crucial role for several reasons: disease prevention, health promotion, access to care, emergency preparedness, research and data collection, advocacy, community engagement. How do we as a Will County Health Department do that? The Family Health Services Division of the Will County Health Department is composed of maternal, child, and population health programs, case management services to DCFS children in Will County in foster care, immunization programs, communicable disease staff facilitate programs to minimize the spread of infectious disease. The HIV sexually transmitted infections prevention program works to spread and mitigate health consequences of HIV and sexually infections. Behavioral health services, services that serve people who are maybe experiencing substance abuse. And this is the short list. The Will County Health Department has been here since 1942 and has weathered many storms. COVID-19 showed us that the Will County Health Department was working with a skeleton crew. Grant funding has strengthened our workforce. For specific programs I named earlier, the Will County Health Department Health Services is it. No other organizations provide what we provide. No other organizations do what we do. We don't want to go backwards. We want to move forward, and to do that, do
what we must do and not see a reduction in staff. I said earlier that the Will County Health Department has weathered many storms. We're still here, and the community we serve across all socioeconomic and racial backgrounds is better because we're here. Let's not create our own storm by depriving our community of needed services, making the community less healthy and more vulnerable to sickness and disease because of a reduction of funds. You've been provided the data. I implore you to provide the needed funds as requested, and thank you very much.
Thank you very much. You're good. Your mic's on, so you're good. Yep. Oh, wait, hold on. You just turned your mic off. Bear with me.
I think I've got it.
Okay.
I'm Dr. Gary Lipinski. I am currently on the Board of Health. Also Chief Medical Director and Medical Officer for the Will Grundy Free Medical Clinic. And I'm a former Chief Medical Officer at St. Joseph's Hospital as part of Ascension. So I know the community, and I know how difficult it is to maintain health throughout this community. There's a lot of disparity. I've been a proud member of the board for the last 7 to 8 years, and I've seen what it has done. I've seen it's taking care of people that wouldn't have access to healthcare in any other way. I also have seen it during the COVID pandemic when it jumped into action with very limited resources and distributed vaccine and took care of the community. Also, we still have a great challenge in women and children's services. Our prenatal care is lacking, and the Board of Health has jumped in and trying to make difference in that, and we have made some difference in that as well. Environmental services are another thing that I think we just don't pay attention to. In large, but being on this board, I've seen all that it's done. It goes through and protects our residents from things that we would just not even think about, like sewage protection from different types of viral diseases. And so I think without that, the community is going to suffer. Without any cuts in the budget to the current Board of Health, I think we're going to see the effects long term. Also, by the way, too, we're starting to see some TB coming into the county, and the Board of Health really is fighting that as well. So I urge you to not cut funds to the Board of Health. I think we're all going to see the consequences in the very short term. But I thank you for your attention to this.
Thank you very much. Please.
Ready? Okay, great. Good morning or afternoon, almost afternoon. I'm Jed Davis, State Rep of the 75th District, which includes a little bit of Will County out on your western portions. I live in Kendall, and hearing all the health department testimony, I'm also a foster parent. And man, the health department has been a vital role in all of that. So kudos to the testimony that we've heard. My family has utilized their services countless times through the years as a foster family. I'm here to talk. I know you got the budget. This is the Finance Committee, the committee nobody ever really wants to be on, because this is the hard work that you guys do that ultimately rolls down to the residents of Will County. And man, I've knocked a lot of doors, and I'm sure you guys have as well. And we're all tax-paying citizens here in this room, likely from a property perspective. But the affordability in Illinois, and definitely in the 75th District, is a pressing issue that I know we're all facing. So I would just here to offer some encouragement. There are a lot of levers in government. You know, in Springfield, there are a lot of levers to pull. And I know on the county side, there are a lot of levers that can be pulled to leverage, hopefully, a reduction, not just in the levy rate, but in the overall spend. Because man, that would truly funnel down, and you could be heroes to the residents. It is not easy. If it was, every county that I represent would be doing this. Kendall, LaSalle, DeKalb, Grundy, they're not. They're having the same struggles. Man, but to be a leader and to provide real relief to people who are struggling day by day would be heroic. And I would just love to see that happen, not just for my constituents, but really for families all over Illinois, because it is not easy work. But when it is not easy, it is very worthy. And I know that as a foster parent, but also as a sitting rep, struggling with making ends meet, right, every day for my family and families that call my office day in and day out. So the word of encouragement, God bless. So appreciate what you guys do. If you ever need anything from my office, don't hesitate to call. My cell phone is in the public domain. Call, text, reach out anytime. Happy to help. Thank you.
Thank you. Thank you for coming to the meeting. Can you press your button? Thank you. Hold on, bear with me 1 minute. Okay, you're good. Go ahead.
Okay. All right. Well, good morning, everyone. My name is Caprinta Merrick, and I am the program manager at the Health Department for the HIV and STI program. As my director had mentioned, my specific position is one that is in jeopardy of our funding that we receive, as well as the work that my staff do. I'm not going to throw numbers at you or anything like that because you have all that, but I want you to see, hey, I'm, a person just like everybody else, and I'm your boots to the ground person. My staff does the dirty work. We are the ones out there connecting with our community, figuring out what they need. How can we help you? HIV and STI are somewhat taboo still. They're sensitive topics. People are open about their sexuality and others are not. And if we close that door to those who have sought our services, we're just going to open a whole nother Pandora's box. And it's just the realistic thing. Again, I don't have anything written. It's just coming from the heart because I love what I do. My staff love what we do. We connect with people on a whole different level and we see outcomes you wouldn't even believe. There's many different stories I could throw at you, but again, we're on time limit, so we don't got time for that. But I am here pleading to you all that, hey, I'm one that's going to be affected. My team's going to be affected. The health department being able to provide those HIV, STI services to our huge community is going to be very detrimental. And I plead to you all that we really could use these funds in more ways than I could, any of my colleagues could even express. And I thank you for hearing me out today. And you to meet, hey, who's running the HIV and STI program at the health department? This one right here. All right, thank you. Caprinta Merrick. So, and if you need services, hey, I'm right here.
Thank you very much. Okay, whoever wants to go first, go ahead.
I, like Caprinta, am one of the ARPA funded positions. I am the program manager with the immunization clinic.
And what was your name?
Karen Sitar-Nala.
Thank you.
Over at the immunization clinic. They have talked to you about all the programs we have put in place and all of the services that we are providing. And it is truly about the services that we provide. It is the employees and the employees right now that are providing those services. As I said, we will lose half our staff. They've talked about our clinics that we're providing, but what I want to do is put a face to what it is that they're talking about, the services. We did clinics over at Joliet Central. They had a goal of keeping it to 100 kids that were excluded because of not having vaccines. We did a clinic over there. We met their goal and exceeded their goal. They had less than 80 students over there. In talking with them about doing this again next year, their new goal was 50 students. If we do not have those ARPA positions, we cannot do that for them. Jody is our homebound nurse, and I want to let her tell you about some of the people she sees.
Okay, my name's Jody Fallica. I've been a nurse for 25 years, and you do not come to the health department as a nurse to make money. That's not the goal at all there. The goal is helping. It's every day. I had a woman yesterday with her senior girl going into senior year, and she was like, I was at Walgreens. It was $278 for me to get her meningitis for her to get back into school, and I had to leave. She said, and then I had a friend tell me to come here. And I'm like, yeah, $23.75. That's every day, people. And that's what me and Karen talk about, getting more knowledge out there because before I came there, wasn't even aware of how much is available. And especially in Moni, I go to the Moni on Wednesdays and we've tripled our people coming there, but we need to do more. Like I said, every time somebody comes in, they're like, I didn't even know you were here. All right. And we've reached out to doctors' offices and schools, but we need to go further out because there's a big community out there that has no idea that we're there. So, and then the homebound, like I tell Karen all the time, like I could cry when I get my car, like these people literally cannot get out of their house. They cannot get out of their house. Like I told her, one couple, she's 94 years old in her wheelchair with a caregiver and her husband's in the bed. Like they cannot get their pneumonia, their flu or whatever vaccines they want unless we go to the home. And I feel like that's underused too. Like we need to expand that out further too.
And those poor people are so immunocompromised at that age and with those health conditions that any family member coming in to see them without these vaccines could send them into the flu, could give them pneumonia, could potentially cause issues.
Thank you very much. Appreciate it.
Thank you.
Do we have any other public comment? Any other public comment? And one last time, any other public comment? Thank you, everyone, for your comments. I greatly appreciate it. Okay, moving on to old business. We have the fiscal year 2026 budget discussion. But before we do that, Kevin, could you, one of the things, I know we've had some questions about what exactly the process is for approving the budget and the levy. And so Kevin, would you please explain what exactly it was that we voted on Thursday and how the rest of this process is going to go?
Sure.
Thank you.
Yeah. So just very briefly, Thursday, you passed the estimated aggregate levy. It is just that. It's an estimate of your aggregate levy. Excuse me. So the main purpose of that is to give the public notice of what you're proposing for the budget, and to comply with truth in taxation and PTEL. When you pass the actual budget and levy next month, it will be broken out differently. You'll pass appropriations for each levy. So the corporate fund, FICA, all those other ones that were broken out. The estimated aggregate levy just gives us an idea of what the overall rate is. So we determine whether we have to go to PTEL or those sort of things. So that's all you did last Thursday was pass an estimate aggregate of all the levy funds. And then you will pass individual levies for each one of the separate funds come next Thursday, along with your overall budget.
So we'll take a vote for each of the levies and the budget. So we'll have separate votes for each of those.
Correct.
At the next county board meeting in November.
Correct. You'll appropriate X dollars to the corporate fund, X dollars to FICA, and so on. And
Okay.
then the overall budget.
First of all, does anybody in the committee have questions about that? Okay, Jackie, go ahead. And then Steve, I see you back there. No worries. Hold on, bear with me, Jackie. Okay, you're good.
I just want to make sure that I'm clear on the process. So we've been given a number now for the levy, 0. We're going to plan our budget, I assume responsibly, based on a balanced budget around that number of 0. Is it feasible, wise, fair to then turn around and change the levy a month from now?
Well, as I always say, whether things are wise is not my call to make.
Well, the reason I
Yeah.
ask is because the point of publishing this is to give the public an expectation. If we turn around and changed it, we wouldn't have accomplished what we were trying to do last week.
Sure, the point is well taken. It does not bind you to stay to that 0% and any other thing that you may have proposed. It's simply a notice thing to get out there. So sure, the public may see something else. We will also have all this published in the November meeting, whatever your thing. But like a lot of things, things change. We add things in public hearing after land use cases. We add conditions. So yes, it is out there to. It's a statutorily required step, but it does not bind you to that course.
Thank you.
Thank you. Steve, would you like to come up? I see you've got a question. You want to sit at number 10? The mic's already on. Give me a break. I don't have to turn another mic on that way.
Oh, me, I don't worry about the small stuff. Now, this is a question for Kevin.
Yep.
Okay, our reserve fund has a 25% limit, right?
I believe that's correct.
Okay, so why is it that the special reserve funds don't have a limit at all? And that every one of them is a different percentage?
I don't know.
Is that
I don't plan
Is that a legal thing? That's when I question you.
I'm not aware. We can look into that. But I don't know why they were planned the way they are. But I can look into that.
Okay, because that's an important question for this group. So if there's a different special fund reserve for each of these different line items or departments or whatever you want to call it, why? So somebody could be 50% and somebody could be 10%. It's not right. We should have one cap for everybody, and it's the same thing as the actual reserve. So there shouldn't be a reason for any of the special funds to be over in the reserve line item. So that's why I brought it up. I thought it was a legal thing, but
I believe at least the 25% is a target for our finances. We could certainly have the
that's
discussion.
on the reserve fund,
Right.
the regular one, but not for the special reserves.
Yeah, and like I said, I can look into that, but I think that's more of a financial planning tool rather than a legal requirement.
It seems like a stupid financial decision
I
to
don't-
let everybody decide what the reserve is going to be. Because if I was head of the department, I would say, give me the most. How much is the most? Whatever they can suck out of the county board.
Again, I don't comment on whether things are
I'm
wise.
not trying to give you a hard.
You guys set the budget. Yeah, you guys set the budget.
Michelle
So
is going to speak in a little bit, and she might be able to shed some light on that, but it's my understanding that our reserve is a target that's set by the state, and in conjunction with our auditor, we're basically, we work with our auditor to set appropriate reserve targets. That's my understanding.
The actual
Sean might be
reserve,
shaking
the
her head
actual
at that.
reserve is 25%, but the special reserves don't have a cap. So that's how it's been going on. So I'm just throwing that out because I thought it might be a legal thing that they could do whatever they want.
Mhm.
And that's why I asked Kevin. Because I don't think if it is a legal thing, we don't have a choice. But if we have a choice, we should have a cap on the special reserves for everybody. They can't go over a certain number.
well, and certainly, like I said, as a practical matter, you do have that in the fact that you set the appropriations in the budget. So
That's why I'm
yeah.
bringing it
So
up now.
I'll look to see whether there's a legal requirement. But certainly I agree that the part of that is been with the auditing and again, once you set the budget and the appropriations, that's what they are for the year. So if there is an emergency, we have other things that come into play. So
Yeah,
yeah.
I would go down and talk to the treasurer and ask him about how that works, but
We'll get
I
that
figured
question
I just
answered.
bring it up here because
Yep.
this group has got to decide on what to spend. So that might be a big number.
We'll get that
And
answered.
Destiny
It's a
did a
good
great
question.
job with her thing. I was impressed, but God bless you guys.
Thank you. Okay, any other questions for Kevin? Okay, then, thank you, Kevin, appreciate it. At this point, then, I would like to ask Rashawn. So it's my understanding that the impact right now of going to a 0% budget or levy rather is approximately $9 million. And so I would like to ask Rashawn to explain what the ramifications are of actually going to a zero levy.
Good morning, everyone.
And Rashawn, if you can answer Steve questions along the way, feel free.
So to answer Steve's question, the board voted on and approved the corporate fund cash reserve policy, I believe back in 2008, which the policy says for the corporate fund that our reserve fund has to be in a targeted range between 22 and 25%. If it's over that, then or below that, then they would put some corrective action or plan what to do with those reserve funds. For the special reserve funds, those are funds that can only be spent on specific things, and they have revenue sources that are generated specifically for that fund. From a legal standpoint, as Kevin mentioned, that's something that he would have to look into to see if there is a limit or a percentage for those reserves.
Yeah, go ahead, hold on. Doesn't want to turn your mic on, Jackie. There you
So
go.
Those are special funds, and I'll just give an example. If you have a fund that's just, you're taking in revenue and the targeted expense is brand new vehicles. If we put a limit on how much they could keep in that fund and they didn't need new vehicles, they'd be forced to buy them, right? If that's the only thing you could spend the money on.
Correct.
So it wouldn't make very much sense to put a limit on how much they can collect in that fund and force them to spend money when it's not needed.
Correct.
Thank you.
Mr. Revis, bear with me here. There you go. Thank you.
I just wanted to throw out that I think while member Trainier's point is very valid, we don't want individuals inside of the county that can make budgetary decisions that are in charge of these special funds to be forced to, spend money that otherwise didn't need to be spent because we put some arbitrary cap on it. But I do think that the point from member Balich that we should be auditing this and have a better understanding of what funds are where, what is the status of each special fund and what we can do with some of that revenue is extremely valid point. How we go about doing that, just something to look into. So.
And just to note, the special funds are all in the budget book.
Thank you.
Julie, did you have a question or?
I did. Rashawn, can you give us a couple of those special funds? And you said there are specific expenses. And specific revenue source.
Right. So in the section of your budget under special revenue fund, we have our large departments. Health department is one of the departments that's in the special revenue fund. 911 is another large department in the special revenue fund. Our Laraway Communication Dispatch Center is another large department in the revenue fund. RTA, Highway, RR&E, Resource Recovery is another. So there's a variation of departments that are in the special revenue funds.
So if we take a look at those and determine that perhaps we're reserving a little more than we need to, if we reduce that reserve, then that will help offset the expenses.
No, because they can only be, those funds are specific to that department or fund.
Correct.
Yes.
But it will offset the expenses in that department.
So if they don't spend those funds, so let's say they're budgeted XYZ dollars and they don't spend all of those funds, those dollars remain in their fund balance. Does that make sense?
Right. But I'm saying if you reserve more money, then if you reserve more money, then you take that they're not spending that money.
Right. So it just remains there.
So the question is do we need that percentage to sit there?
No, because you're putting parameters there. So in other words, you're forcing them to spend it.
Okay.
Dan, go ahead.
Just to kind of elaborate on that a little bit more. So if you have a special fund and you have money set aside, but while doing budgeting, you determine that you don't want to allocate from specific generators $1 million for that fund. You want to allocate 500,000. And then you decided that you were going to take that other 500,000 and say, send it to the health department because we need to make cuts. And these are generators that can offer money to our budget. Would that be allowable?
No.
No.
If the board made policy to do that?
No.
Okay. And why doesn't that work?
Because
Explain that.
there are certain statutes, state statutes for those special revenue funds and where those dollars can only be spent specifically based upon what the state statute
Okay,
says.
and that, I get the opioid fund, but what about cannabis?
Cannabis funds can be used for other departments.
So that is one area of a special
Yes.
fund generator that could happen.
Yes.
So I think that's what Julie was getting at. Right?
Yeah, exactly.
Okay.
Steve, do you have a question for, and then, come on up. And Destiny, did you have a question? I see your, okay.
I think that we need to have a special meeting on these funds called special reserves. Because when you're talking about the cannabis funds, okay, that's just all the money we're getting from the tax from the cannabis, okay? It's not coming from tax dollars, it's coming from something different. So that may fall into a different category where we don't need to have regulation on that. But each of the departments are setting their own cap. So you start bringing all these different departments in and saying, well, why do you need this much money? Because we don't even know the dollar amount. So I can't say a dollar amount, but why do we need so much money? Why can't everybody be capped at 25% like the regular reserve for the special funds? And that's where I would start. And if they want to go over, that means they're taking money and spending money that we didn't authorize. They're doing it because they say they need it, not the county board, who's responsible for all the budgetary. So I'm just saying we shouldn't be just like mixing apples and oranges by saying cannabis fund or this other fund when it doesn't include tax dollars. These departments, they're limited. They should be limited to the same cap. So we have to look at what are the caps now that they have? Why is somebody's cap higher? Why is somebody's lower? And come up with an equitable cap for the special reserve funds and figure out which ones we would eliminate out of that. But that's up to the county board. We're responsible for all the money. So when we're talking about cuts, there's a big cut right there. There's a huge cut because I'm not going to say it's happening now, but I remember back when I was fighting about bonuses or stipends or whatever. Certain people were on the board at that time. I think Denise was, Jackie was. I don't know if you were there, Joe, but land use was the worst. You know, they were getting $10,000 bonuses or stipends or whatever. And then we let it go because our leadership, Mr. Frizzalone, he said it's cheaper to just let them get that instead of giving them a raise. But I'm thinking they make enough money anyway, so why would they have to get a bonus? You know, so there was a big argument at the county at that time about it. So again, that goes with reserves, same thing. Why do we have no reserve cap for the special reserves? And everyone's talking like it's okay for this and okay for that, but there shouldn't be that. There should be a cap for everybody, and then we figure it out. And is that the right way to look at it, Rashawn?
Let me just ask a question really quick
I'm asking,
first.
is that the right way to look at it?
I'm not sure what you mean by special reserve funds and
There's
caps.
reserve funds that we have.
Right.
And that's like for emergencies or whatever, and that's capped at 25%. We don't go around and say, whoa, how much money does the reserve fund that for emergencies, how much should we really be putting in there? Okay, that's probably a state thing, but 25% is a lot of money. And then you turn around and you say, okay, what if you use some of that reserve fund because we needed it? Well, we replenish it the next year. That's all. We keep it at 25%. So with the special funds, why is it that we can have them in the budget, in our levy or budget or whatever, ever? It should be capped, that they can't get any higher.
So are you saying
And then they
that,
got to give us a reason for it to get to whatever they want to.
so are you saying that for the special funds, you know, that are dedicated funding sources that we can't use for anything else, that once they hit a certain amount, dollar amount, that we should no longer collect tax revenues for them?
No. No, you're way off.
Okay, I'm really confused
No,
about
I'm-
what you,
I'm-
but
I
I'm
didn't
gonna,
say
I
that.
see Rashawn's shaking it, shaking her head.
asking
so.
Rashawn if it's a correct budgetary process to have departments say what their cap is for special funds. Hell, what if they said they want 75% cap? And Jackie said because, well, they want to buy a car or they need a truck or something. Well, if they want that, they should be coming to the county board and then we say if we're going to let them get it or not.
I think I'm
So
just
I think-
confused about what caps are, but go ahead,
If I
Rashawn.
may, I think, so the departments with the special revenue funds, they present their budget request. The responsibility of the county board is to appropriate the funds, and that's done through the budget planning process. So when you're talking about capping or putting a cap on the special revenue reserves, I can tell you that some of the special revenue funds do not have a healthy fund balance or overzealous fund balance. So they only budget what they actually need, and the county board appropriates that. So what you're mentioning is going a little bit further than what the county board's responsibility is.
They come to us and say, we need a new roof. The computer system's broke. They come to us anyway.
If it's outside their budget.
Well,
correct.
So the special reserve thing, if you have a cap where they can just do it on their own without going to the county board.
Well,
the
there's
cap
certain,
should- There
there's,
should be a cap on that special reserve
There-
that they can't do it. We need to put it there. That's what I'm saying. We, as a county board, legislative body in charge of the money, need to put the cap there. So they can't go over it ever without coming to us first.
Well, that's what
And
the
that's not
levy
bad.
is.
yes, so departments cannot go over budget, and there's policies in place that once the budget has been approved, the only way a department can spend throughout the year if they need to increase their budget or if they need to use emergency funds, which is the corporate fund cash reserves, they have to bring that request before the board and you approve that. So you see those requests throughout the year. They cannot go over budget and they cannot spend reserves without county board
So
approval.
why do we need to have special reserves then?
Some special,
So they don't have to come to the county board.
No, I
That's
think,
what it's
no.
about.
It goes for the corporate fund and as well as the special revenue funds. It doesn't matter which fund they're in. No one can overspend their budget or use cash reserves
Right,
without coming to the board. So I think.
But they're not overspending their budget if it's in their budget.
I think you're right because you've appropriated that.
Correct.
During the
And
year.
I'm saying we should cap it. We need to take a step further and cap it. And I guess we're going to argue about this and the meeting will go on until 1 o'clock this afternoon. So I should shut my mouth and go sit down again. And, God bless everybody in the room. I hope you guys make some good decisions and make me happy.
And we can sit down and go over that one by one.
Go ahead, Rashawn. Sorry about that.
No
Thank you.
problem.
Appreciate your question, Steve.
So, Sherry, back to your original question. I think the levy that was approved last Thursday. So from my understanding, the request at 0%. So going back to the 2024 levy would be, the difference or the change would be about 8.9 million. I'm not sure. I think there's clarification that still needs to be defined here. The final 2024 levy was $156,582,739. It sounds like what the vote that was voted upon with the 0% and was 156,424,615. We have to make sure that we go back to the final levy because that's the extension point that you start with when moving forward. So if we could get some clarification on that, because that would be the actual starting point the base point as to where we need to start in moving forward to the vote.
Jackie, I've got a question and then so that 8.9 million does include using the corporate fund to replenish the
So that
money
would-
that we've already been obligated to in the tort immunity, workman's comp, IMRF, and I think there was one more.
Yeah, it's the corporate fund. So the changes that amount to that would be the corporate fund, IMRF, tort, and workers' comp.
Okay. Because we are going to be under the amount with the 0% levy, we're going to be under the amount that we're essentially already contractually obligated to in those funds.
Correct.
Okay, thank you, Jackie. Hold on one sec. Okay,
So can you take money from the corporate fund to replenish the tort immunity fund? You cannot, correct? Because you levied at 0 for the tort immunity. Or can you?
So because tort and workers' comp are combined with the corporate fund, you could.
Okay, that's
but we
one
don't have
question.
separate,
However, it is a separate levy that we do fund for those two funds.
And then the second question, I was trying to grasp what you were talking about when you were reading those numbers. I know we put out a levy dollar, like let's say next month of last year, a year ago next month. But that's not necessarily exactly what we collected in the levy because things fluctuate between now and April. So are we talking 0% over last April's number or 0% over last November's number?
So it would be 0% if that was the vote over last April, because if you recall, I come to the board in April and provide you with the final levy numbers. So in October, you estimate what the numbers would be, and those numbers are extended, and then the county clerk's office provides us what the final numbers are in March, and I present those to you in April.
thank you. Julie, go ahead.
Oh, okay, so Rashawn, I have a question regarding, you brought up our, FICA, IMRF, so those expenses. In all of the budget summaries we receive from Marcy, which I absolutely appreciated, they pretty much all state that the department's budgeting for 3% salary increase. It seems that everyone I've seen has taken that 3% increase. And the CPI was, what percentage?
2.9.
Okay, so I do know that I've been out talking to residents and many people are not getting raises, especially not at the 2% level. This 3% increase, that has an impact on that IMRF number, correct? And it also has an impact on the FICA obligation we have to pay, correct?
Correct.
And there should be a couple more. What else does that impact?
So we have FICA, IMRF, sworn law enforcement personnel, which is the sheriff's office, and health insurance.
And workers'
Okay,
comp.
so, but given that we are proposing an individual levy for the sheriff, they're not all lumped in with everyone. So what I'm gonna put out there to our board is that I think we need to look at this and say, we don't need to assume that the salary increase is 3%. We don't need to assume that. We can lower that because we have to look at the taxpayer throughout, I'm sure, north, south, east or west. There's a lot of unemployed people out there. I mean, they're getting, in fact, there's a lot of people looking for jobs. So that needs to be part of the conversation. And I'm not saying that we're going to take anything away from our sheriff. or our courts, but some of the departments. I mean, the question is, do we just give everyone a blanket 3% raise when everybody, there are people out there struggling? So
So Julie, we have union negotiations underway. Are you suggesting that we start
No.
over on the negotiations?
So for recorder of, let's take, okay, we've got all these different budgets, recorder of deeds. It says right here, they're giving they're proposing 3% increase. Is that tied to a union?
I would have to look at the recorder of deeds departments, but I believe, yeah, they are union.
Okay, so we have absolutely no impact or input on that salary increase. Is that correct?
Correct, because we're bound by contractual agreement. Yes, yes, yes.
Yeah, sorry. So when we negotiate.
Hold on, let me turn your mic on.
Sorry.
Thank you.
So when we negotiate, like we're doing is we go to the county board for a framework and we have done that already. So
No,
that,
I
so no, it is,
understand
yeah, so it is, I mean, it is not, so something right now, we have what we, oh, I'm sorry, yeah. So the existing budget is what we currently have. So that has been negotiated, so
Right.
we cannot change that. And moving forward, you give us a range for us to stay in. So that would not be able to be changed either. So no, we can't just go back and say next year we're gonna change their amount because that has already been negotiated and approved by this board. And we do go to the board before we even work in a range. Yeah.
And
that-
what month is that on the?
We just voted in executive session on Thursday on this.
Some of it.
Not all of it.
No, no.
Some of it.
That's what I'm
But no,
asking.
we did a couple months ago before we started with AFSMI. We went to the board and in executive session, we always talk about a range. Yeah.
All right, so I'll talk to Chuck about this. Maybe we can have some sort of a schedule just so everyone knows what to anticipate throughout the year. I think that'd be really helpful. Thank you,
Yep.
Jennifer.
Mark, I'm going with committee members first and then I'll call on you. Destiny, go ahead. Oh, Rashawn, let me turn your mic back on.
Thank you.
Sorry. Okay. Oh, I just turned it off. Sigh. Thank you. Okay,
Okay,
go ahead, Destiny, then Mark.
thank you. So
Sorry, I turned it.
in the general corporate fund, under personnel benefits, FICA, Social Security, IMRF contributions, and health insurance, all three of those that were requested were lower than the amount that we recommended. Can you explain why that was?
Yeah, so when the departments submit their request, they're not, we receive, there's a rates for FICA, IMRF, SLEP, and health insurance. So most departments don't calculate total salaries. And so when they submit their request, once we are wrapping up or doing the compiled budget, we make sure that those calculations are correct.
Okay.
So you'll see the difference between requested and recommended.
Right. I was just curious because it seemed as though they were asking for, what did they ask for? They asked for example, in FICA, 10,730,672, 10 million, 10.7. And then we recommended 11.2 million.
Correct, because most departments, they don't calculate, they take full-time, part-time salaries. However, if you have overtime, if you have holiday pay, longevity, the rate is based on total salary. So whatever your bottom line number is, would be calculated at that rate.
Okay.
And if you looked at our previous year's actual, you would see that our numbers are close in line what the actual came in at.
Okay, I was looking at the year to date, 9 months in, we're at 7 million.
Right, so and that was at a point in time in August.
Yes.
So if you take a look now, we would be closer to that number that was budgeted for 25.
Okay, thank you.
Okay, go ahead, Dan, and then Mark. Sorry.
No problem.
Yeah, I just want to, because I keep hearing that we have these obligations that we have to take care of, so we must raise taxes. And that is a simple way to handle those obligations, correct? Is to raise the tax levy to cover the extra obligations that you are going to incur, that you are planning on incurring.
So you said two key words, raising taxes. So to answer your question, we have obligations that we are responsible for, and we have to fund those. I can't answer your question on raising taxes. However, we present in the proposed budget a levy proposal.
Which a levy does represent an increase in taxes, correct? Okay, you don't have to answer that. I think the room knows what that is. I'm just saying, is there another way? I mean, could there be some other way that we could achieve those goals? I mean, when we're talking about the future and we have to set a budget, I mean, have you ever heard of a company or an organization that might make certain cuts in order to allocate money to create funds for what is a new priority? I mean, is that also possible?
So, Dan, if I may, before the budget is presented to the board, we review all of the department requests and go through the budget. We've reduced almost $25 million before it's even presented to the board. County department requests totaled $306 million. The recommended proposed budget was $282 million. So we have gone through it to reduce every possible thing that we could have done. We take into account all possible, we look at previous years, actual, as well as year-to-date, what departments have spent, and what their actual needs are. So we've already reduced the budget before you even see it. Millions of dollars, $24 million to be exact. So do we believe in reducing? Absolutely. We only added 5 new positions this year.
So, and I can appreciate that, and I thank you for that hard work. I think as a county board, one of the main powers or authorities given to us is to control the budget. And we control the purse strings. And so the county board has spoken. Are you saying that you cannot meet that budget? Is that what we're being told here?
No, I think this is the first of discussions that we're having.
I just
based
want to
on-
make sure that there's still room and that, it's not an insurmountable task to actually run this government and not increase taxes. And that's all we're saying. And that is the power that is vested in the county board. And so I do appreciate you, whoever other people are who went through this budget, but now the county board has spoken and we need to revisit it. And I just want to make sure that you, the group that went through it before, can attain this goal that we set. Is this an impossible goal for you?
Well, Dan, I think we're looking to the people that
I'm just
voted for the-
asking because
I'm-
it sounds like, I'm not asking you though.
Well, I'm the chair of this
But
meeting and I am
I'm directed
commenting.
my question to the expert.
I'm suggesting that we, those of us who did not vote for the 0%, are looking to the people who did to show us a way to achieve that goal. I mean, it's really, that's
To
my take on
question,
it.
Is it possible? Is it possible?
Mike, I will let you chime in on this. Bear with me.
I just asked a yes or no question. Is it possible?
You know what, when you're dealing with
I'm not asking you.
well, I appreciate that you're
Board
asking
member
the
has
question.
spoken, an elected official has spoken.
But
and
Mr.
asked-
Mahoney has the floor. Point of order.
I
Thank
believe
you.
I had the floor.
You don't anymore.
Thank you, Chair. I appreciate that. And I just want to remind everyone that we have a delightful form of government here, the executive form of government. And while the board did voice its opinion in last Thursday's board meeting, nothing is final without the executive's word on things. When you're looking at an $8.9 million budget deficit created by this vote from the board, I just want to remind everyone what we're seeing today in proposed budget cuts, what this does, and you take things as seriously as the time people put into it. This doesn't pay our FICA taxes. This does not pay our taxes, right? So the county becomes delinquent on taxes. This does not pay our debt service. This does not pay our utility bills. We will be turning the power off in 4 months with these proposed cuts. We will not pay for jury trials, so we will be denying the constitutional rights of Will County residents. We are not paying for first responders' radios. We are not paying for employee physicals, which saves the county hundreds of thousands of dollars in healthcare expenses per year. And I would like to add that we had heard previously today talking about spending out of reserves. Spending for operationally out of reserves is a fool's errand. I cannot stress that enough. Other collar counties have done that. I implore you to look at the Kane County budget situation, the McHenry County budget situation, and the issues that they are dealing with right now because the county boards thought that it would be easier to spend out of reserves than make the adult governing decisions. So with that, I would gladly take any questions on some of these things, but please know that governing is hard. Running a county is not easy. Trying to end jury trials for county residents is not an acceptable answer and will never be an acceptable answer to the executive's office.
So was that the answer to my question?
Point of order.
Was that the answer to my
I
question?
don't know. You haven't been recognized, Mr. Revis.
Oh, for God's sakes.
Thank you, Madam Chairman. So I'm just wanting to comment on Member Ortiz's proposed cuts. I think she did great work putting all of this together. And with it in front of me, I just kind of thumbed through the pages and identified some of these cuts that I deem higher priority than some of the others. For example, to kind of echo what Mr. Mahoney said, personnel benefits, you know, I know that that's a very complicated, fragile item, and I wouldn't want us to see us focus on something that large right off the jump here. So while I appreciate that being added, the 1.25 million in savings there, I think we should, you know, hold off before we go into the personnel benefits. But there are others on this list that are, I think, of higher priority, such as things that involve supplies, equipment, auto supplies, computers, commodity supplies, operating supplies, building supplies, technical services, and then property services. Those were the main ones that I looked at. Maybe we could even look at like travel as well. But, you know, looking at those, that gets us to nearly 5 million in cuts, which is, you know, a step again in the right direction. And what really couches all of this is just my experience since our Thursday meeting. I have been out in my community like most of us, and many people are coming up to me and they're thanking us for our work that we've done to estimate. At this point, it's just an estimation, a 0% levy. People have heard what we're doing. They really appreciate it. This doesn't discount any of the efforts coming from the executive's office. We know that they are doing good and they are, focused on delivering a better experience through fiscal spending at the county. But I think the 12 individuals that voted for the 0% levy estimation want more. You know, we heard a lot about needs from the health department, and while those needs are very valid, the need for services is lesser than the need for us to take action on out of control spending at government. While I think our spending is relatively in control, there's always more we can do. So I really appreciate what Member Ortiz put together with these proposed cuts. Again, just to reiterate, I think we should prioritize the things on her list, such as commodity supplies, operating supplies, building supplies, equipment, auto supplies, computers, technical services, and property services. And those take us to about nearly $5 million in cuts. Thank you, Member Ortiz. I have a question for Member Ortiz. The recommended amounts that you have listed in here, are those, this is the first time seeing this. I haven't had a chance to look at it or compare it to the actual budget. Are those
where did you come up with those numbers from?
So those numbers I calculated based on our year-to-date numbers, and I just projected what they would be at the end of the year, and that was the recommendation I came up for next year's, because I noticed that a lot of these line items were very much inflated.
So you didn't take into account any like increases in maintenance contracts or, you know, vehicle service contracts or any existing contractual relations that were already obligated to when you came up with those numbers?
I did take that into consideration, but again, I looked at the numbers that we were proposing year-to-date and the proposals that we were taking next year. And so when I seen a huge discrepancy between those two numbers, I did make cuts in those areas.
And you're basing the discrepancy on the fact that year-to-date we had not spent, you're not looking at the timing of the contract, like whether we pay for it monthly, whether we pay for it in a big chunk. I mean, you were just basically saying, what have we sent so far and doing the math and extrapolating it out?
Correct.
Okay, thank you. Let's see, Jackie, you're on the committee, go ahead. Oh, I have to turn your mic on, sorry.
Thank you. My question is for maybe Rashawn, Marcy, Karen, if she's around. Do you typically expend all of a line item's budget by the end of the fiscal year? Or do you get many, many bills that come in December and January and February and March?
So once the year end close, some departments, fourth quarter would be where they would expend most of their budget. And once the year end close happens at 11/30, we have that 90-day lapse period up until the end of February to close out the previous year's budget.
And let's just say, I'm just going to do a hypothetical. Let's say the Department of Transportation is out of auto parts line items because we didn't budget anymore and they don't have another line item to take from. How would we help, say, for example, the plows get adequate tires when they've already spent all the money in their line item?
So if they've spent all the money in their line item, they can't transfer, then they have to wait till the next fiscal year until they.
So we can tell the residents in that neighborhood we'll plow their street when we get more money the following year, would be the answer. Thank you.
Dan, is that your light on still, or was
It
that?
is.
Okay, we'll go Dan, then Jim after that. Or Destiny, do you have your light on again?
Yes.
So
Okay, so
I
we'll go
under-
Dan, Destiny, Jim.
I understand my question won't be answered, so this one is for Mr. Mahoney. So the list of services that you listed that would be not funded if we were to do a 0% levy is the representative of the executive, is this what we can plan that you are willing to cut? These are your cuts that are planned for the 0% levy? Is that?
I think you totally misunderstood that. No, these are the cuts that I am seeing here that the board is proposing.
The board proposed to cut the courts?
Yes, the jury trials are slashed in half. And so we would run out of money for jurors midway through the year, as well as not having electricity on in the courthouse. So yes, those are all issues that then the executive's office would have to face as we administer
Okay,
government.
well, that's the first I've heard of that, because as far as
This is the first I've heard of it
It's like-
too.
it's just that the way I've understood it is that we set the budgets, that it is ultimately the departments or the heads of those departments that actually make the cuts. We can't tell you what to cut. So you are the ones that will make those decisions. So if you ask for a suggestion from somebody and I don't know who that is, then you certainly do not have to adhere to it. We can only say, this is how much money that we want to fund. And it's up to each department to make those cuts and to do what they need to do.
Sure, and the example I'll give you, right? So utilities, natural gas costs are going through the roof, as well as electricity. Anyone who has to pay a utility bill knows that, right? And so if the county board in its wisdom says you get 1.6 million for electricity, and our electricity costs next year are going to be over $2 million, we will run out of money for electricity, right? And then, so where does that lead us? Do you want us to spend money that you appropriated elsewhere to cover electricity, or would you like us to turn the lights off? And so the same can be said with all of the utility cuts proposed in here. Technical services, right? So you run out of money for the court reporters. You run out of money for special prosecution. You run out of money for indigent attorneys, something that, boy, is sorely needed these days. Guardian ad litem, court-appointed attorneys, expert witnesses, jury trials, property appraisal services so that we won't get accurate property tax data from these huge warehouses with the trucks that are moving in, so we can't go to special technical experts on things like that. So yes, it will have a great impact on the running of government. And well, I understand that you think you can just pass a budget with numbers on it. The numbers have real life consequences.
And I totally understand that. And that's what we're hoping for, that there will be consequences. And one of the consequences will be that taxpayers will pay less money and the government will be forced to be more efficient and use their money more wisely. Okay, so when you come out and you make all those statements in your adult fashion, I find it insulting, because what we're trying to do is save the taxpayers' money. Okay, we're not, I certainly didn't agree to cut any of that stuff. And I didn't really understand that it would be my place to say what gets cut and what doesn't. Okay, I believe that we are not allowed to make those decisions. Okay, so saying that is inflammatory. Okay, and I don't appreciate it.
I think we should call up the state's attorney to get a ruling on whether or not the county board has the right to appropriate. I think that might solve this.
We do have the right to appropriate, but we don't have the right to tell each department how to spend its money.
We don't, but in my opinion, if we are going to propose cuts to the budget, that we ought to be prepared to show where it makes sense to cut. I mean, this is based on a wish list. I wish prices weren't going up too, but they are. And I was very comfortable that the proposed budget was a good reflection of reality. These cuts in my mind are not a reflection of reality. And so I think that's where, and it's my position that if we, and I'll just say we collectively rather than, point out individual people, if we collectively want to reduce our spending, I do think we need to be prepared to say where we want those spending reductions to be. And Member Ortiz has done that. So anyway, thank you. Mark, go ahead.
Oh,
I'm
Mayor,
sorry.
please.
Destiny, I apologize. Go ahead.
Thank you so much. I feel like you're just sitting up here trying to be funny, because in no way, shape, or form did we cut that juror budget in half. It was cut by $36,000. There was $210,000 proposed and $174,000 recommended. So please do your due diligence and go through these before you try to say that we're just cutting all these services when we're actually not. So at our last finance committee, the county executive's chief of staff said that their office is more than willing to work with everyone on the budget, and I truly appreciate that. Mr. Mahoney also bragged that they had already reduced requests by 25 million, which we heard again today. Off the top, thank you. Kudos to Sean. So since the county executive told the press that members of the board who voted to hold the line on the tax levy needed to come to this meeting prepared with potential cuts, I said, challenge accepted. Okay? So after going through this line by line in the budget, I identified nearly 26 million more in sensible cuts from the corporate fund that do not touch wages, staffing, or public services. We're talking about inflated supply budgets, padded professional service contracts, unnecessary contingencies, and overfunded line items that even the departments didn't request. So I hope that the executive's office will keep their word, saying something that they're very big on, and take these recommendations into great consideration. The chief of staff also reminded us about the importance of efficiencies in government, and I quote, "And I agree, but clearly they weren't efficient enough. Luckily, I was more than happy to help them out. I'm glad to hear that they've reduced their Amazon purchases by 19%, but let's be honest, that just proves how much unnecessary spending there was before. That's not the flex you think it is. And the same goes for the 33% reduction in credit cards, a good step, but again, not the flex you think it is. And the cell phone audit shows that we could cut that number in half, and again, not a flex. So let me be clear, I absolutely unequivocally support increasing staffing, raising wages, and retaining employees, But that starts with honest budgeting and responsible leadership, not misleading narratives. So while some might try to paint me as unsupportive of unions or workers, the truth is the opposite. I'm fighting for a government that actually values its workforce by protecting their wages and taxpayers footing the bill. And I want to be crystal clear. The claim coming out of the executive's office that rejecting the 2% increase in levy means we can't afford wage increases is simply not true. I was shocked and disappointed when the county executive and her chief of staff made those claims in closed session last Thursday at our full board meeting. I've had union representatives calling me all week long, worried about their members, and it's a shame that the very first message that the county executive's office puts out after we held the line on tax levy was misinformation that created unnecessary fear. The truth is, I've identified nearly $26 million in cuts that don't touch employees or services. Before we ask taxpayers for a single dollar more, we should prove that we can be responsible with the money we already have. These cuts show that there is room in the budget and that responsible, transparent leadership means making the tough calls at the top, not passing the buck to working people. And again, these are all just suggestions. This is not written in stone. We can take a little bit of here and a little bit of there, but if I was able to catch $26 million, that's more than enough room to work within. Thank you.
Did you want to comment?
No, I was called up. I'd prefer not
Oh,
to comment. I
okay.
don't have to.
Okay, go ahead, Mark. Let me turn your, there.
Tough act to follow there. I think Destiny Ortiz said it excellently. You know, I don't think we're trying to do anything too aggressive. What we are trying to do is deliver the message that many of us get inside of our districts from residents, young, old, everybody in between. They feel that government continues to spend money. They're not listening to them. I know we had a lot of advocates in here speaking on the opposite side of things today and, you know, continue funding and things of that nature. But, you know, at some point we have to look at it with clear eyes and say, maybe it's time for a rollback. You know, government cuts aren't a bad word, especially when you're going into depressed times with the economy like it seems like we're looking at right now, whether it's the fault of the federal government, state government, or, you know, all the other governments underneath county government. But, you know, I really think Member Ortiz really did a great job. That's why I just, on her list, I was focusing on it seemed like the less impactful items. Commodity supplies, you know, what happens if we run out of ink? Oh, well, we run out of ink, you know, I mean, I don't think we're going to get to that point though, you know, operating supplies, things that aren't items that hinge on someone's job, their income, their employment, you know, building supplies, things of that nature. So I really think Destiny did great work on this and I appreciate it again. So yeah, that's all I had to say.
Jim and Joe have been patiently waiting, and then Denise. Jim, go ahead.
So I guess from my perspective, I'm filling in for David today. So my discussion is more about revenue. There's two entities within our government that have bled us dry of about $5.5 million over the past year. One is the RNG plant, and one is Sunny Hill. So that's what I'm going to focus on. I'm no way focusing on labor. What you're actually going to see is I'm going to actually increase labor. So if anybody's taking this as we're after labor, no. Right now I'm focusing on management issues and the corrective actions that need to be taken. Our RNG plan over the past 2 years, and I actually wrote this out so this way, because sometimes the numbers in my head just start spinning. So over the past 2 years, the RNG plan has lost $2.5 million per year, cumulative $5 million. I was under the impression, discussing with them the other day, that they may break even this year. Now, with that withstanding, the first $5 million that they do make will have to go to pay back the loss that they experienced in the first 2 years. We have to look at ourselves as if we were a private equity investor in this. And we would not give somebody this much time to actually turn a profit. I know it's an innovative technology in that, but we're always we should be demanding performance and profitability out of this. So if they could actually generate $500,000 to $1 million in net profit next year, I think the way we do that is we have them do a monthly P&L. And with that, what we can do is we can track their progress and make adjustments quickly as opposed to waiting for quarterly or end of year type of results. So that would be one area where I would like to see us actually generate some revenue, or actually profitability, I should say. The next is Sunny Hill. You know, I agree. It's a great facility. It has high scores. Currently, there's 157 people in there, roughly, plus or minus. It does vary day to day. But what I looked at is it looks as though there could be a capacity of over 238 people in those beds. Now, that changed somewhere around 2016. I don't know the exact information, but it changed in that area there. So based on my math is we have a utilization of about 60%. And anytime you're dealing with real estate or that you always, or business, you always look at real estate or sales per square foot. In this case here, what we need to do is figure out a way to bring up that revenue stream and capture more revenue. They are actually working on getting somebody to come in and help them start capturing more revenue from the Medicare, Medicaid, and private pay. And Mike, you even mentioned that we might raise the monthly rate, by some figure, some nominal figure of that. But according to my math, we lose about $3 million a year, $57 per day per bed, roughly. I'm hoping that if we can actually increase the number of people in the beds, that we actually will be able, through economies of scale, actually generate some positive revenue. There are some advantages that we have that the private sector nursing homes don't have. We have no debt service. We pay no rent. We pay no mortgage. We pay no property taxes. We have no legal department. We have no sales and marketing department. All our capital needs are covered by our corporate fund. Last year, I know we did get some ARPA dollars. We put in some new beds for them, which is great. We also put in some new security doors, and this year there's a request for $750,000 for a new roof. All advantages that a private nursing home does not have, but our nursing home does have. So these are things that we need to open up our eyes and understand more about. So let's take a look at actually how the money is being spent. Right now, we currently spend on temporary services to the tune of about $2.1 million. Let's take a little trip down memory lane. In 2020, we were only spending $554,000, and I'm rounding a little bit. 21 was $790,000. 22 was 2.3 million, 23 is 2.5 million, and 24 is $2 million. That's an exponential increase in contract services, temporary services. If we were to take those dollars and actually hire more CNAs, our new entry-level CNA makes $43,000 a year. Fully burdened, they're at about $73,000 a year. If we were to take that money, factoring in at a $75,000 cost, we could increase and have 28 more CNAs in-house. Those are dedicated staff that are dedicated to the mission and are hardworking people, and those are good paying jobs. All right. Now, the other thing that we need to look at is we cover about $1.6 million in overtime. Overtime, in my opinion, is a morale killer. What we need to do is look at optimizing our staff. When I say that, if you look at, if you're forced to work overtime or that cuts in on your family life and that. So maybe what we need to do is look at optimizing that by having like 3 10-hour day shifts, or 4 10s, 3 12s, something like that. What that does is that gives the employee either a 3 or 4 day weekend. It in turn, they don't have to drive as often to and from work, which reduces their overall cost to their family. So again, good paying jobs with some work, family, quality life in that. My proposal is we bring in a consultant. We bring in a consultant to look into optimize the whole operation, not only just scheduling, but how is it that we're doing business and where can we actually make improvements? I did mention that we have the 238 beds, capacity 157. We say there's a shortage of good facilities. And like I said, back in 2016, we reduced it to 1 person per room. So if we can capitalize on some economies of scale, we could possibly close the gap on that loss. And by increasing that revenue, we would in turn get closer to a break-even point. Now, I know during COVID, we did take and expand our residency to where we were taking people out of district or that. Maybe we need to look at that too. Look at changing that residency thing and or charging a higher out of district fee. Again, this is all part of having some somebody come in and help us optimize the facility. And I think too, just like the RNG plant is, what we need to do is have, monthly updates and progress reports on what we're doing and how we're changing the game over at Sunny Hill. I know it's a great facility. I know the people there like it and that, but we have to try and right the ship, so to speak. I've had staff, reading through the minutes and that, I've had staff and colleagues state on different occasions that there's such a huge need and a waiting list for people. So all the more reason we should expand it to maybe doubling up on the rooms. And also too, is there's only 13 counties with nursing homes left. And many of them are looking to close them because they're unable to keep them up. And we have this jewel. So if we have a jewel, then let's get in there and let's figure out quickly how to stop losing money, give the people what they deserve is a quality nursing home facility, but at the same time too, not let this keep being a drag on the property tax owners or the property taxpayers. Because it all comes down to a cost to them. Lastly, I mean, Springfield did say that we should start preparing for a 4% cut. Maybe they know something that we don't know. But again, I think that's something that we should look at as a whole. I've gone through the budget books page by page, like I have in past years, line item by line item. And we've been told as elected officials that we don't run the departments, that it's the executive office and the elected official and the elected officials in those departments that do those things. So all I did this year, or that I'm going to present to us this year, is from the county board's perspective, our budget. And I'm just going to run through it real quick. I mean, telephone savings, $200, office equipment, $750, furniture, $1,000. None of this seems like much, but it all adds up. Laptops, take $1,000 off. Consulting service, drop that down by $20,000. Advertising, $1,000. Freight, drop $100. Air travel, cut that by $5,000, and lodging by $5,000 for a total of $34,000. Doesn't seem like much, but in my math, it's half of an employee right there. So, and none of these things actually impact our labor. What they do is they try and optimize our spend on each of these areas. So that's all I have. I appreciate you listening to me. And if anybody wants, I'd be more than happy to meet them wherever and discuss the other 170 some pages. So thanks.
Joe, go ahead. Oh, I have to turn your, sorry. There you go.
Thank you, Chair Newquist. I know I'm not on the committee, but so I will keep my comments brief. I just want everybody in this room to look through the lens that I've been looking at over the last couple months and why are we here today? And probably the thousands of people that are online watching this meeting. That's a joke, right? So I know the county executive and her office has offered every board member the opportunity to bring their concerns with the budget. I have also offered that myself as speaker of this board. I was promised by a couple members that they would be willing to sit down with me and give me these ideas. And I did receive one request, and it was an impromptu request 1 week before the budget vote or the levy vote last week. And there was zero concerns brought up with the levy at 2%. So now after the levy has been passed, this Hail Mary was thrown out at zero because everybody likes to hear the word zero. And it passed. And now we receive a document with the proposed cuts that an individual has given us, which I believe anybody on this board had the opportunity to present this months ago, and we would be in a much better place. So thank you all for taking time out of your day. I think this is, it's not a complete waste of time. I think this document should have been presented a long time ago and we'd be a lot farther than where we are today. So that's my statement. Thank you.
Thank you. Denise, did you still want to speak? Can you hit your, thank you.
Just for clarity for me, maybe I misunderstood something on the front end, but Sean, I'm sorry, familiar. As I remember, at the outset of the budget, the mandate for everybody was that the most that any budget could increase for a total overall was 2%, which meant that they had to basically operate on last year's money already. Am I wrong?
No, you're correct. And if you recall, I think in April, we had a special finance meeting that the chair held. and had all of the departments come forth and talk about their needs for the upcoming budget, in which they outlined those so that there would be no surprises with the FY '26 budget.
So now in October, almost November, even though we kept basically last year's money, we're gonna operate next year on last year's money. Now we're asking to go further. Thank you.
Did one of you guys have your light on here? Okay, Julie and then Lori. Thank you. She's had her light on. Go ahead.
Okay, so I hear the comments that were just expressed, but this year is really no different than any other year. So we're not later in the game where I've been on this board too. This is the same process. We're not running late. This is similar to what happened last year and the year before. Rather than, complain about effort and indicate that perhaps this is too late, I'm looking at the information that was provided by Board Member Ortiz, and I do have a couple comments on a couple things on here. For the computers, so it states desktop computers, laptop computers. Who are these computers for? How many computers is this for? How many computers do we need every year?
Member Berkowitz, I cannot answer that question off the top of my head, how many computers we have. However, departments have their computer replacement on a cycle. And then also, if you recall, the sheriff's department has been replacing their computers over the last couple of years because Windows is becoming obsolete. As a matter of fact, Windows 10, October 14th, in which that deadline has sailed. So they had been replacing those computers, and most departments, instead of buying a chunk of computers for their department at one time, they have them on a replacement cycle.
And that number also includes software licensing, correct? Which we have to pay every year.
There is a line,
does
there
say
is a
that.
line
That's a
item for that as well.
Right, so given that these are all clumped together, we're not sure which department, but that is something in certain departments. We need to find out, is this for land use? Is this for the sheriff's department? There is something here that says sub-grant award and obligations. What are those?
So that is monies that is dispersed to outside organizations by a department, mainly land use, for programs that they offer or services that they provide. This is a line item that's been in the budget.
Okay, so this is from specifically for land use.
Could be one potential, yes.
It could be other departments.
Yes. And,
Okay.
and this is without getting, this is a high level, so we'd have to do a deeper dive to see what departments.
And I agree, we do. We have to do a deeper dive because I think land use, I know, working with them, they don't have much to cut. They have a big job, land use. They're out in the community, they're working hard. But we do have some areas where how much money are we spending? How much money are we spending on these fairs? How much money are we on, the food drives, the things like that? If we're spending taxpayer dollars on those, if we are, we have to, okay, no time for staff. We're not paying staff salary, any benefits, nothing, even if it's on a Saturday. Okay, but I did also have a question, and Lori's here, so I'll take advantage of this. Lori, with the autopsies, how do you determine if you need to have an autopsy? If it's required, and how many do you
Hold on,
have?
Lori. Hold on 1 minute. Why is it? There we go.
It's based case by case. It's depending on what is happening with the situation with the case. There's no predictor. Okay. Secondly,
How many did you have last year? How many autopsies?
you know, because this was not a question posed to me, I cannot tell you. I know it was close to, and I'm not even going to comment on how many because I want to be sure of the number. I will send it to you in email. Okay. You can't predict autopsies. I've had this discussion before. I can't predict when people are going to die because if any of you have that power, a 13-year-old child would still be alive from last night. Okay. Because the woman would have been there. You please let me finish. I can't predict autopsies. And if you can, good for you, Julie.
I
Bring me
didn't
that
say I
information.
could, Lori.
So the decisions are made case by case basis. Case by case. I have explained this multiple times. And please, can I remind you, I'm a taxpayer too.
Well, it wasn't personal, so,
It is.
there is.
one, and there's questions I have as well. So
Lori, hold on, your mic's off again.
I have a question.
Lori, can you hit your mic if you're still speaking? Thank
Free
you.
of the chair.
You're not, you're done? Okay,
Done.
okay. Go ahead.
I just want to say, you know, I appreciate having countywide officers here to discuss their budgetary, the implications our decisions in this committee have, but I don't think it's fair to just have one countywide office here. I think it would be appropriate to have all of them here. If we're going to allow one to speak, we need to allow them all to speak. They all have needs that are valid, and it's not fair to just give one of those countywide offices the floor to speak about their needs while we neglect the others, such as the clerk's office, the auditor, and things like that. That's all I wanted to throw out.
Come to the meeting.
I understand. I'm just throwing that out there. You're the chair, you get to decide, but
Okay.
it's not fair.
Anybody else? All right. Okay, Destiny, go ahead.
Thank you very much. So I just want to say that I find it very insulting that the county executive's office would come and invite us and offer an invitation to meet with us to discuss the budget, tell us to come here with prepared cuts, and then shake their head no at anything that we proposed. If you have a problem with something in here that you absolutely cannot support, why are we focusing on that, and why are we not focusing on things that we could actually find common ground on? So I'm going to go through this just a little piece of this so you can see what I'm talking about. Fax supplies, $5,750 proposed. Year to date, we've spent $0. Does anybody hear fax? I'm pretty sure not. Okay. Books and periodicals. Why did we not spend any money year to date then? That makes 0 sense. And we're talking about contractual services. Okay, fine. Let's not focus on that. Let's focus on other supplies where we can make cuts. For example, machinery, we have $200,000 proposed. We've only spent $31,000 year to date. Office equipment, $51,000 proposed, yet we've only spent $85,000. Actually, that's more, so we have to fix that, right? There's things that we need to move around here. Furniture, I know the county speaker has gotten a very nice desk in his office. I'm sure that wasn't cheap. $88,000, $89,000 almost proposed in the furniture budget, yet we've only spent $45,000 year to date. And the list goes on things that look, chemicals, $10,000 proposed, we spent nothing year to date. So if you want to talk about things we can cut so we don't turn off the gas and turn off the light bills, that is perfectly fine. But let's not come up here and make jokes after we ask all of us to come here with cuts and proposals and then just shake our head no at anything that we had written down. I mean, there's a bunch of stuff in here. Travel. Where are you guys going on the taxpayer dollars that you want us to fund? $93,000 in mileage, $55,000 in air travel, ground travel, $13,000, lodging, $170,000 proposed for lodging on the taxpayer dollars, $7,000 for meals. This is ridiculous. We need to literally sit down and keep our word like we say we want to do and try to find some more cuts, because you can't sit here and say you're the only one that can find cuts. We can't find any cuts. That's absolutely ridiculous.
You want to go over there and turn on Jennifer's mic? I know she's dying to speak.
Yeah.
I want to hear Jen.
No, it's, yeah. I'm,
You're on.
am I on? All right,
Yeah.
well, thank you. So just because I understand that the county executive does the presentation. I will begin with the fact that I do not deny that any of the county board members can come in here and say, hey, why do we need to chop this down? We need to look at that. I will say that $26 million that not one, but two budget directors have not been able to find is probably a little bit unrealistic. Do we think we can go and find things, travel, for instance, a perfect example. I'm going to tell people right now, I don't travel on the county dime, right? I pay for tickets for myself. So I can appreciate that. A lot of that is when staff travels, I don't think they should. Our staff has to maintain professionals. They have to do certificates. They have to do things like that. Again, we want a well-trained workforce. So yeah, can we go through this? And you could probably say not this year. A lot of the dollars too, when you look at budgeting, you have to remember, we may need something and it's a software renewal, right? And it's blank all the way to the time that it's in November when it's the time to renew something. So that's why the expense will be paid. Same thing with our contracts. They're not all on December 1st, we're paying them. So a lot of times we will see things at at the same level to the very end. I do not have any doubt that you could go in. I could probably go in. We could all do it. I could go into your department and say, do you really need this? You can go into mine. I can go to the other elected, they can go into mine. I do not doubt that we can find several places where we could get cuts. Are we going to be able to find whether we're not sure if it's the 3.5 or the 8 million. I'm going to say in all sincerity, again, we rely on two budget people to help us get to where we're at. So I want us to be, cautious. These ideas are good, but some of them are not going to be realistic. I'm going to acknowledge to Mr. Richmond, him and I have spoken about Sunny Hill, and I'm going to say it publicly, like I've said to him, I understand. And I am, when he first mentioned it, like I said, I get it and I want to work with you. It's not something we can right the ship overnight. It takes time. And we have not acknowledged that. Yeah. Yeah. And yeah. Yeah, no, yeah.
I'm sorry.
Well, yeah, and like I said, I understand that. And Mr. Richmond in meetings have shared certain areas that and again, I'm always open to look at them. And I'm not saying you haven't said that. So I mean, like I said, we are always open. Everything isn't perfect. We're not a business though. We're not, we are a government. We're not here to make money. We have to, we have to sustain what we're doing. And again, I'm going to say the same thing like Lori. I'm a taxpayer too. I've shared this with people. I am a taxpayer. When I create this budget, I think of what probably you are all thinking too, right? What am I going to have to adjust? Again, much like I'm going to say to county elected, I don't ever complain about my salary, but county elected officials do not, because somebody said we do not get raises every year. I'm a set income. And so when my school district, when my fire protection district, my village, when they all raise things, when the forest preserve and this, I have to take that into consideration. So I budget the same way. I will tell you, I too am out in the community, and I know everyone says they talk to all their neighbors and stuff. Like I said, I will be honest. I don't hear much about county services. My greatest joy was the comment made by a school board member in Minooka on my Facebook comment about our taxes when they are raising their 6%. So again, I want people to know I take what our staff does seriously, and not that you don't either. Can we find cuts here and there a little bit? Is it going to come up to 8 million? I don't think so. I think it's going to be extremely, extremely hard. And my argument has always been, why do we want to do the shock and awe? Why do we want to say 0%? Why can't we have conversations beforehand so we're not in this, we're not in this position? I'm glad all the county board members are here, a lot of them here today, but I know we've had meetings that we haven't even been able to get a quorum. And that is my biggest anger with all this, right? We didn't have to do this. We could have had a conversation, said, Jennifer, fine 100,000, fine 200,000. Would it change the levy a lot? Maybe or maybe not, but this has been my frustration. And so understanding this takes just a little bit more than just looking at the end numbers, because everything is done on cycles. And sometimes it's a matter, we need a new car and we can't order the car until July, August, September, October. Again, so it's a little deeper than end numbers. And I'm guessing that most people know that we're not going to find $26 million, but I think so.
All right, Joe, then Mark.
Thank you again, Chair. I just kind of wanted to set the record straight. The Speaker's office does have a very nice desk, and I can thank a fellow department for that, because that desk did not cost the county board a single dime. It was repurposed. Also, like, may I continue, Mark? Thank you. That desk was repurposed just like our coroner did when she had a brand new building and repurposed a lot of that furniture to save taxpayer dollars. So I don't want anybody to think that I went out and spent thousands of dollars on a brand new desk. That was gifted. So thank you.
Mark, let me turn on your mic, and then Dan.
Okay, I just want to throw a couple things out at the wall. Maybe they stick, maybe they don't. I do feel that the county executive and Speaker Joe Van Dyne are doing a good job at listening to our side of the aisle and trying to incorporate a lot of the ideas that our team has been bringing forward in terms of lowering property taxes, lowering the impact of spending on our residents. And I appreciate that very much. I know a lot of what we're doing here challenges the work you have spent over the past couple months getting everything together and all those small variables that we just can't account for being on the board. So I don't want you guys to take this as like us saying, you guys aren't doing enough, you're doing a terrible job. I really don't want to say that. I don't even want to leave that impression, because I truly do not feel that way. So I guess that's a thank you. That's a long way to say thank you for that. And I know we have a lot of work to do, and I appreciate the compromise that this board and the committee are working to get to. You had mentioned something about, Madam Executive, about our contracts and how some of them aren't all, pay on December 1st or January 1st or whatever. Is there a possibility we can look at all our existing contracts, work with the state's attorney's office, and try to get everybody on a, January 1st is the day one of the contract all the way through the end of the year? Is that possible or no?
No, because they're all renewed at different times. No, that is not going to be possible. I will tell you this, in my 5 years, we have, and again, a lot of things are modernizing that we haven't had. We have worked hard with our purchasing department, and sometimes to save money, as we're going to, sometimes when you save money, you have to spend a little money before you save it. I mean, we're talking about, let's look at Sunny Hill, bringing someone outside to take a look at, because again, we do things the same way over and over and over again. And maybe somebody else has it outside. We're not always have the best idea. So sometimes you have to spend money to do it. So we have looked at things like our energy that has gone down. We're looking at our purchasing. For the first time, we're taking record of our fleet management, right? So there are little things that are being done, even our paper, right? We have never had any real type of organized effort. So a lot of things that you do not see on a day-to-day basis, nor should you, right? Nor should you. We are trying to improve. Is it getting like, hey, good job, good job, departments? Good. No, it doesn't. But what you're asking is happening. It's probably just not happening at the speed that you want to do. So to answer your question, a long way to answer your question, no, that's probably not it. But what we're doing, because again, sometimes we have found, and again, because elected officials change, right, too, and in department heads chair. So sometimes things get lost. What we have found is that we can do a better job of recording things, so we don't let contracts lapse, like, oh, we have a year and this something, we're not using that anymore. So we are creating systems to help better organize that. And some of that's just because technology allows. You have programs that allow it to. So I wish it was that easy to do it all in a year, but it's not.
Yeah, and then my last comment that I'm not trying to give up any ground or, lose any steam for our effort. But, you guys came with 2%, the board said 0%, is a 1%, even, obviously that's a little bit more agreeable when we come to that. I mean, we could try and still compromise for a lower number without staying so hardline committed to 0%, just trying to work in the point that anything is better than that first number we're given. And it shows that we as a board, you as an executive office, we're working in collaboration to try and lesser the burden on our residents.
And Member Revis, I am always willing to compromise, and I'm glad you said this. For some reason, this board, it's kind of been an us and them, a Democrat, Republican. We want this, you want that, and again, we've heard it. We've heard it a lot. It's uncomfortable at times, right? We all know that. I am always willing to do this, and again, I don't mean to like share conversations that we have had, Mr. Richmond, but I mean, there's nothing that it's nothing, but I told him this when we first talked about the budget. Part of my conversation with him is why I started at 2% was because that's what was offered out last year. And I am listening. I know what's going to be said, right? And I don't want to put our members in a bad position. I mean, I don't want to put Democrat members in a bad position and, and Republicans, because we can all do this. I can do it just as well too, right? We all know how to do it. So I do try to listen. I tried to start at a point that was reasonable. I didn't hear anything. I thought we were in a good position and I had no reason to think otherwise. But yes, like I said, we could probably go through this and I'm sure you're going to be able to pick off 5,000, 1,000. Is it going to come up to that? I think it's going to be hard. I'm being sincere when I say that.
Well, I think we can still give it a try.
Yes, I am not dismissing that.
Yeah, and
you have to remember too, when we make a decision today, this is future. We talked about other counties right now. When you stop, and make 1 year to put there's a trajectory forever with all this. So again, it's now, so.
And I would like to just say one other thing,
Again, Jim, I did twice.
Yes, it's a valiant effort. We should still give it a try. In terms of the split on our board, obviously it's no secret. We're 11 Republican, 11 Democrat. We have a real beautiful opportunity to lead not only the way of the state of Illinois, but lead the way in the country for how a bipartisan government can be ran healthy and, and still meet our obligations. I'd love to see Democrat member Destiny Ortiz really working in a bipartisan fashion. I know that's something that I always try to do, and there are others on the board that do that as well. So I think we're getting there, and I'd like to see the progress that we're making. Thank you.
Dan and then Micah.
I can walk away now.
And then actually Dan, Jackie, Micah.
Everyone else can go.
So I just want to say, nobody asked me if I agreed with the 2% budget. And, through Open Meeting Act, we're supposed to do our business on the floor. And that's what I did. And that's what I will continue to do. I've tried to talk to people in advance, and then people get pressured. You got to do this, you got to do that. And then I can't do what I want to do. And I vowed, you know what, from now on, I'll take my business to the floor. I'm not talking to anybody behind the scenes or, going to let somebody tell me, well, if you do this, I'm going to do that. It's not going to happen. So whenever I have something to do or say, or an amendment to something, I'm going to take it to the floor. And I don't think anybody should expect it to be any other way.
Mr. Bartlett, we had numerous committee meetings where you didn't voice any objection to the 2%. I'm just noting that.
I didn't vote for it.
You did not. That is true. Jackie, okay.
Thank you, Chair Newquist. I liked the comments that Board Member Revis made, but I think it's kind of disingenuous when it's a Hail Mary on the final day in the full board meeting. When, as you say, Member Newquist, that, we've had numerous committee meetings and I didn't see anybody bring forward this list of cuts. I didn't see a single person say, hey, how about if we go with 1%? I know that our CPI was 2.9%, and we could have, as some of our board members say, tax to the max. We don't do that. We issue our levy dollars based on what we need, what we absolutely need. And we have reduced the levy many times. after the initial amount has come out. But it's been done in committee through cooperation of talking to the board members, talking to each other. But this last minute playing got you, that's not bipartisan. That's just a gotcha game. And, you've got people like, whoa, where's this coming from? Folks never said a word that they were against this 2%. All of a sudden now they're voting for 0%. So I just don't think that this was done very well. And we can all sit out and throw out arguments and, condemn somebody else's work. But until you're in their shoes, doing the job, making those hard decisions, telling a department they can't have the money that they just asked for, even though they've presented the case on why they need it, why it's important to that department, and then we just say, sorry, can't have it. You're going to have to keep using those, obsolete computers or whatever the situation is. And I see some of the elected officials shaking their head. We're trying to do the best that we can to live within our means. And the health department is a perfect example in that they have seen a 43, 48%, whatever the dang number was, increase in costs, but their levy has only went up 12%. I mean, they're being creative. They're finding ways to get things done. Yeah, they use some ARPA money. Yeah, they use some CARES money. And now that's gone. But we still have the health of the residents of our community at stake here. And as far as the RNG plant goes, man, it's something new. It's something novel. And it's something that a past board approved. We're here now. And I commend Member Richmond for saying, hey, let's try to have updates more often. But I think the people that are in that building that are dealing with it day to day, they don't want to have to come and tell us that they didn't meet the goal this month. They're working their butts off to try to meet the goal. I don't believe they're in there saying, oh, well, we blew some money. Oh, we shouldn't have bought that. Or, oh, we should have bought this. And they don't care and they just go home. I think they do care about their job. I think they are trying very hard. I just can't believe in the negative. I don't think that benefits us.
That wasn't what was.
I'm not trying to debate you. That's just how I took it, and I'm saying how I feel about it. That's my role. I have that option. So it's a new project. The reason we got into it is we looked at it as a long-term plan so we wouldn't have to raise the tax levy and property taxes. Because eventually, if it works the way we had hoped, it's going to pay for itself and so much more in the long run. And it was a huge investment. Let's hope it pays off. Let's keep a positive attitude toward those people that are working so hard to try to make money for our taxes, for our residents. Thank you.
Okay, now wait, I'm confused. Micah? Hold on, let me turn the mic on.
Thank
Okay.
you. So I'm sitting in the back, I'm listening. I come to all the meetings. I've only missed a couple. I hope an attendance sheet comes out at some point because I would love to get that out there. But I'm gonna agree, it was a Hail Mary. For the last 5 years I've been on this board, I've heard it every time we come to a budget. It's nobody says anything and then it's like minus 10%, 0%. Well, we're here now. So all of those back and forths, it's mute. Because the point is now we have a 0% on the floor. We have to figure out how to move forward. As Mr. Reva said, I do truly believe that these beautiful ladies in their departments in finance have done a very good job and they have trimmed a lot. I do not feel that the proposal that came forward today is realistic, but I do feel like an effort was made. So I'm hoping that we can maybe get onto the focus of where do we go from here and how do we get a solution to the situation that we have been put in. Thank you.
Thank you. Kelly, Marcy, were you?
No, I had not.
Okay, Kelly, hold on. Let me, there you go.
Thank you very much. I too have been listening from back there and over here and back there. I've been everywhere. But anyway, I really sincerely feel as a new board member that I was told I was welcome to find economies in the budget and to discuss things that were in the budget. But we need to know the ramifications of the changes that we're talking about. And, you know, I feel like that's what the months leading up to this meeting, or actually last week's meeting, were really about. But again, as Member Freeman said, we are here now. And so I think it's important to look at the context of the numbers. I think that it's a less than thoughtful view to demand cuts and have no idea what is going to happen as a result of those cuts. Nor are any of you being held accountable for the outcomes. That would be the department heads that would be held accountable. And they have worked on these numbers with our finance people. And I feel like since Thursday, there's been this air of a group of people who are the parents who say you can have ice cream for dinner, but don't have to clean up the puke. You know, I mean, it's just the truth. And sorry to be so graphic, but that's where we are. And we're a group, we have to figure this out together. I'm open to keep talking about this. I have come down here, I'm not on the committee, but I really want to hear what we can do at this point. And rather than hurl accusations, find real workable solutions that will make sure that we can meet our obligations and continue to pay our employees a decent wage and, you know, make sure that we are taking care of the people of Will County, because I hear a lot of talk about taxes. I don't hear anything about federal taxes. I have to say, when I talk to people about taxes, that's usually what they're talking about. But a dollar's a dollar, right? I get it. But rather than accusations, we need to get those workable solutions, and we need to find that we're still meeting the needs of the people of this community. And I think that there's room to do this, and I hope that that's where we can go going forward. Thank you.
So Mike, correct me if I'm wrong, but I think the next step in this process really is for the county executive and the finance department to go back possibly and relook at some of these numbers, or please give me your perspective on it, if you would. Let me, thank you. Okay.
Yeah, as far as we're concerned, the county executive proposed a budget that had a 2% levy increase, included new property. The county board on Thursday voted at 0%, no new property. There's going to be a difference of, as Rashawn said, $8.9 million in there. We have a list. I don't know what our role will be in this. We can go through items on the list, but however, you know, it's going to be a board decision at the end of the day. So.
Actually, bear with me for one moment. Kevin, I do have a question for the state's attorney's office. Yeah, thank you. Can we as a board vote on specific items in the budget, or do we need to vote on the budget all or nothing?
So we are researching that. In the past. We've definitely, I believe the opinion has been that you approve the budget as a whole. You're not voting on line items. Obviously, there are amendments made, but you're not line item, $4,000 for copiers, whatever. You're voting on a proposed budget.
And does the budget has to be balanced, correct? So like, in other words, we can't vote on a budget that features a 1% increase, say, and a levy that's an overall 0% increase.
You are giving budgetary, you're giving, saying you can spend, or this is the money we're appropriating to you. That would be not only illegal, but it would be financially disastrous.
Okay, thank you. I agree. I just wanted to make sure.
To the specific outcome of what would happen, again, as I think I've said before, we're dealing with things that don't normally come up. So we are researching these as they come along.
Thank you. So Mike, maybe the better question is, what does the executive's office need from us, the board, to make this budget a reality, or whatever budget we end up voting on or agreeing on?
Great question and kind of uncharted territories, but we would hope for a compromise on a balanced budget, right? And we're going to have to be part of that conversation. We have to administer government. We have other countywide elected officials. I know somebody was just talking to me about like, hey, if we run out of ink, that's a real problem. And if you think like the clerk's office running out of ink before an election, that is a real problem. And so those are problems that and pitfalls we have to take into consideration when we do things like this. But I appreciate Leader Richmond brought forth some ideas for some savings. As always, we are willing to work with anyone on all of these, but they have to be realistic in the administration of actual governance.
Okay, Julie and then Jackie.
Thank you. Okay, so I want to talk about two funds, the opioid and the cannabis fund.
Julie, that's on the next item on the agenda, the cannabis.
This applies to the budgeting process. These two funds have kind of been managed by a team of county board members that's, I guess, picked by the speaker. I'm not sure. And during its time, it's been reallocated. They take the dollars and they allocate it to organizations. I'm going to propose that these two funds specifically be reallocated to Will County government functions so that it stays within our taxpayer region, which is from the north side to the south side, east and west. You know, that would give us the ability to take this money and help the CAC, help the state's attorney, help our judicial branch, help law enforcement, functions that we know are countywide functions. They go directly back into our communities. Right now, we apparently have over $2,500,000 in the cannabis. And I don't know what we have in the opiate fund. So I'm proposing we take that money and we put it in our budget where it's most needed. Okay? So that's my first proposal, to take that money. So we are keeping it within the county. It's still being used and the people are still benefiting from it. But it is also helping us focus on our never-ending shortages as a result of opiate use. We're seeing the increase in services needed at the CAC. Our sheriff has come forward, health department, we've seen the impact within our county. So I'm proposing that we take those two funds and change the process in those two funds and keep those dollars within the county for the benefit of countywide residents. So that is the one thing I would like to move forward. And I'd also like perhaps to have the county executive take a look at these different departments, take a look and see where the cuts can be made. Let's not necessarily tell you where they have to be made. Take a look at it and come back to us, because that's how private business runs their budget. We're no different other than the fact that we take our dollars from the taxpayer, because granted, I understand you don't want us to tell you what to cut, and I agree. So I think you can go back and take a look at those budgets, see where there can be some things cut. And there are certain areas where I don't think we should cut, but there's other departments perhaps we can cut. So that's what I'd like to have moving forward. Thank you.
Thank you, Jackie, and then Dan.
Thank you, Chair Newquist. Rashawn, did we have $26 million left over this year? And the year before and the year before?
Repeat that question.
26 million. I think that's what this pile of paper said. These are cuts we could make. If that money wasn't needed in prior years, it should have been left over and been shuffled over to the reserves, correct?
Correct.
How much did we have left over last time that we put some money in the reserves? Do you know? I
Mm.
mean, I know you weren't expecting this question.
No, I'm not prepared to answer that. So,
And I mean, do we ever?
and I
have
don't want to
money-
throw a number out there.
Do we ever have money left over?
We do.
Okay, because I know we had to get to the reserves number.
Yes.
I know there's a lot of talk about that. People don't remember back in the day, we didn't have reserves, so we had to go out and take a loan and pay interest on the money to pay the bills for the first 4 or 5 months of the year until the first property tax receipts came in. But now we have reserves.
Yes.
And I know, I think it was 2 years ago, we had too much in our reserves, so we spent a little of it. We've done that a couple of times.
Mhm.
But I mean, if we didn't have $26 million left over last year, I'm thinking we're not going to have it this year. And I'm thinking it'd be really hard to cut 26 million or even a portion of that 26 million out of this year's budget. And in my opinion, and maybe I'm in the minority, and maybe the state's attorney needs to weigh in. But if we voted for a 0% levy, then we need to make amendments to the county executive's budget to equal that 8.9 million that you talked about earlier, to say these are where we want our cuts to come from, because she came to us with a 2% levy. And we said, nah, we want a 0% levy. So it is now incumbent upon us to make those hard decisions. And, you know, giving me a list of 26 million is fine, but what are the 8.9 million that we're going to focus in on? Because I don't think that that's the county executive's job. Maybe I'm wrong, but I think it's our job. And I don't think it's the department's job either. Because we are the appropriators. And our budget isn't just cut into like 5 slices or however many countywides we have, 8 slices. It's all the way down to the, you know, toner for the copy machine. So we made the 0%. We made our bed. Now we got to lie in it, is kind of how I look at it. So, you know, I'm waiting to hear from my fellow board members exactly where the 8.9 million's coming from. Thank you.
Dan, let me put your microphone on. Okay, go ahead.
So, first of all, I just want to commend Destiny. As, you know, every day I find out that definitely one of the more intelligent people here. She found $26 million in cuts. Take your pick where you want to take them. We didn't ask for $26 million in cuts. She just went all out saying, here's your opportunities. We only asked for 0. That's 8.9 million, whatever. Okay, not 26 million. So let's quit talking about cutting 26 million. She's just saying, I don't know. Is she, you know, a finance major? I don't know, but she managed to go through this and find this. So, you know, let's not misquote this. And I know that some people may want to defer. I noticed there's a trend on, you know, the other side of the aisle to defer to the staff to take on their responsibilities. I know for a fact that there was a vote on 0%, and everybody who voted for that did not want to defer the responsibilities. And if we pass a budget, those departments cannot spend more money than we allow. And if they want to, they will have to come back before the board. And that has happened in the past. And we have taken it out of our cash reserves. So if the clerk runs out of ink, lo and behold, we will do our duty and we will supply them with the money to get that ink. I just think that there's a lot of nonsense statements that are being put out here. If you want to do the work and you want to figure something out, quit making inflammatory statements. Let's just talk facts, okay? Thank you.
Anybody else? Okay, then before we move on to the next agenda item, I just want to remind everybody that we do have another finance meeting coming up in early November, and we are going to have to finalize essentially, what we want to do by then. And so once again, I, would encourage everybody to have discussions and be willing to compromise. And that's my comment on that. Thank you, Rashawn. Appreciate it. Okay, moving on to number 2, the Cannabis Fund budget discussion. I'm going to start it off by saying that I actually agree with Member Berkowitz that I believe at this point we should take the cannabis money and just put it in the corporate fund and use it toward making up some of the shortfall. Jackie?
Thank you, Chair Newquist. I would agree. I don't think we need to send any money to CSC or CASA or United Way, Joliet Cares, Scholarship Fund, Prairie State. I think we need it for in-house. That's 2.5 towards fill in the hole.
Right, we could send it to the health department or it could go to fill in another budget hole. That's so. Mr. Logan, hold on a sec. Okay, go ahead.
So myself and Member Ortiz, we actually sat down with the CAC, CASA, Housing Stabilization, Workforce Services, Problem Solving Courts, and we listened to them. And there are real people that are affected by this money going to these programs. To just do a flat out that you're going to just throw this back into a corporate fund with no real reason where it's going, that would be a disservice to all of these. Including the ROE. Joliet Fire has a program which is going to be able to assist mental health throughout the entire county. So I think that statement is a little flippant at this time. I do know that we have decided that Prairie State and United Way could be removed. And I know the county department, the finance department actually would look forward to having a little bit of a leeway in there. But I would strongly disagree with taking this and just throwing this into the fund. Cannabis funds are supposed to be used for cannabis stuff. If you read it, it's outlined very specifically what it is. Just to throw this in there would be a huge disservice to what this tax money is going for.
Thank you. Julie?
Okay, thank you. So year-to-date 2025, from the cannabis funds, the Child Advocacy Center has already received $345,000. Problem Solving Courts has received $225,000. That's 2025 this year. Housing Stabilization Program has already received $520,000. Workforce Services for Worker Reentry Program has received in 2025 $180,000. Child Care Grants, I don't know where these grants are, who it went to, but they received $111,900. So we're not just pulling the rug out from underneath. These organizations have already received money. And I think right now we have to look at the situation here. We have to address what's going on within Will County government. And the CAC will continue to benefit from the county. When they come forward to us, we've worked really hard in the past to always give these organizations the money they've asked for, especially the health department. So they, right now, and I love that program for the Joliet Fire, and we can figure out how to make that work. But right now, we've got to address this budget shortfall, and perhaps there's a way to get that program off and running. But right now, I think we need to take a look at this and address that situation first. Thank you.
Denise, let me turn your mic on there. Okay, thank you.
We do give money from the county to these organizations, but there is a gap in what they need to operate. And as I understand it, this cannabis distribution is to fill that gap.
Right.
because they have a shortage as well. And so this money fills that gap. And also it's restricted, so it can't go into just plain general fund. This is to fill the gap that they don't have enough money for. So this is not a place reasonably where we can use that to fill the shortfall we have in the overall budget. It doesn't seem like, unless I'm missing something here.
That's what I've been told.
It seems like in the overall budget, what we need is to relook at that with the help of Sean, Marcy, and Rashawn, and Marcy, and Karen, whoever, and try and figure out where we could scrap up 1%. Because it looks like that the zero is not going to be workable, especially if we look at the cycle on how contracts are paid, even though I realize now at the end of October, we've only spent a certain amount of money, but some of that money will not come out of the main budget until January and February, unless I misunderstood. So we have to plan that just a straight math calculation will not get us to the numbers that we need. We have to look at the different things and how they come out. So this is not going to be a place where we're going to be able to save that money, I don't think. And the zero is not going to work in the overall budget. At least it doesn't look like it from what I can understand, unless I misunderstood the budget director.
Jackie, go ahead, and then Kelly?
Thank you, Chair. I just want to point out that prior to 2020, we never gave a dime to the CAC. Not one thin dime. I've done the research, I've looked it up. We served almost as many people in 2019 as we served last year. But when we now give them lots and lots of cash in addition to a building. So I don't necessarily think that every organization on this list isn't deserving. That's not my point. And I do think that we have services. Again, I'd have to talk with the budget directors and I'll come up with some ideas, because I honestly thought people were going to come forward with some amendments today on how they were going to fill this $8.9 million gap or 9.8 or whatever.
This is just discussion. We can't vote on anything.
Yeah, no. I thought there were going to be actual amendments made, but you know, I just think that there are areas in the health department that deal with mental health that, you know, clearly the cannabis dollars would be useful for. So that's the only reason I agreed with your comments on that. But, you know, until I take a look and talk to the budget directors, know where my questions are coming next. You know, I can't really say, but I do have an issue with us using this special fund to kind of incorporate regular budget items that we believe should be a part of the budget. I mean, housing stabilization used to come out of the CDBG, but now it's creeping into cannabis. You know what I'm saying?
Mm-hmm.
So either this is a cannabis fund and should be used for, you know, things that were offsetting on the effects of cannabis, or it's corporate fund. And then we could just throw it in the corporate fund, which a number of these things, you know, have been paid out of the corporate fund. So if these things could be paid with cannabis money, that things used to be in the corporate fund, then I don't know why we can't just put the cannabis money in the corporate fund. So, thank you.
Kelly?
Thank you very much. I'm on the committee.
And then Dan.
Could I speak first since I'm on the committee?
Actually, Kelly's been waiting. You were out of the room, so go ahead.
I haven't left
Okay,
the room.
so I
Did you-
just
I'm
have to.
sorry, then I didn't see you.
Okay.
Go ahead, Destiny. She's on the committee, so.
I'm sorry, it'll be quick. I just want to remind everyone that previous boards made an intentional decision to dedicate cannabis revenues towards closing the wage gap and repairing the harm caused by the war on drugs. So I'm adamantly opposed to moving these funds into the corporate fund. I think moving these funds into the corporate fund undermines that commitment, and it removes the transparency and accountability that our residents deserve. These dollars were never meant to become general revenue. They were meant to serve the communities most impacted by the war on drugs. So we owe it to them to keep that promise. Thank you.
Thank you. Dan's on the committee, so if you don't mind.
Right ahead.
Him, go ahead. I've been trying to do committee, you know.
I appreciate
ahead.
that.
Well, I'll save you a little time. I am in favor of keeping it the way it is and not putting it into the corporate fund. I mean, this gives us some flexibility. Much of what she just said about betraying the people's trust. I mean, we agreed to do this to help out the community, so I'm not going to repeat what she just said, but it was pretty good. Okay.
Kelly. and
Thank
then
you very much.
Julie. I don't know if
Thank
she
you.
comes on again or not.
I completely empathize with what Member Logan is saying about these dollars help real people. And believe me, I would love to fund almost all of them with no context, but some do need some context. The Joliet Fire Cares Program, giving them $350,000. My understanding is they're not looking for money. I have met with them. I have talked to them. I have emailed with them. They're not looking for money. So I really think that this is kind of, you know, it's not appropriate. I don't think that there has been enough work done to see what is actually needed. I've heard of other funds on this list that are not necessary, according to the institutions. So I just would like everyone to make sure that they are committing this money where it needs to go. You know, and if we're looking at this as money that could help to, you know, remediate some of the $8.9 million that we're short, I mean, this gives you a little bit of a head start, right? It's just 6 more mil to find. But I really think that at this point, I would have to say that I would want it to go into the general fund. So thank you.
Thank you. Anybody else?
Yeah.
Oh, sorry, Julie, I don't know if you had your.
Yeah, I did. So, I didn't indicate that these funds needed to be transferred to the general fund. So, what I said was that these funds should be allocated to certain areas within county government where we serve all our residents. That includes the incredible programs through the state's attorney, the CAC, our sheriff. They've got an amazing the programs, the hidden in plain sight. Those are all programs that are in our budget. And what I'm saying is we can use these dollars to help pay for these expenses in our budget rather than distributing them to outside organizations, because at this point in time, there is nothing inappropriate with these funds. If we allocate these funds, as long as they benefit our Will County residents, we never as a board declared that they had to go to represent fair and equity. I don't know where that came from. The board never made that, never came forward with that. But again, these are the funds that we can use to help address this budget issue, and that's all I'm proposing. I'm not proposing that they be handed out to programs that aren't addressing the impact of drug use. And absolutely not. We have needs. This budget book is full of multiple programs that address those needs. And that's where I think we need to stay focused. Thank you.
Thank you. Okay, anybody else? Well, our purpose today was really just discussion. We are not going to vote on anything. And I think we've had a really good discussion. I want to thank everyone for their participation. Okay, moving on. Other old business, we don't have any. We don't have any other new business. I have no announcements or reports by the chair. We don't need an executive session. And so I will take a motion to adjourn. Motion Trainier, second Winfrey, all in favor? Aye, opposed, we're adjourned.